Hello, and welcome to this informational video on Sunrise Clinical Manager Viewer Training. Today we are going to cover the application SCM and its many uses. To start, logging on to SCM. When logging into SCM on a non-tap-and-go workstation, locate your Citrix icons on your desktop. You should have two icons, a manual storefront and a Citrix storefront. Double-click on the Citrix storefront icon to open the storefront. When the Citrix storefront displays, enter your domain, /username, and then password. If you are logging into SCM on a tap-and-go workstation, either tap your proximity card or enter your username and password and click OK. Once you are logged into your workstation, click on the Citrix storefront icon on your desktop screen. Citrix will automatically log you in when the application is launched. When Citrix storefront opens, it opens you to the home screen where you can favorite your most used apps for ease of access. To find the SCM application, click on the Apps button at the top of your screen. Locate SCM, and if you would like to favorite it so that it is on your home screen for subsequent logons, click the star on the top left of the app. Now when you log on, SCM is in your favorites. Single-click on the app to open. When prompted, enter your username and password and click Login. After 30 minutes of inactivity in SCM, your SCM Citrix session will time out and then log you off after 1 hour. If you are using a VDI session, please note that you will be prompted for your password every 4 hours. When logging into a unit-specific workstation, your main screen will be populated with the status board of the unit you are on. To flip between the status board and the patient list, you can use the button on the left-hand side of your screen. For demonstration today, we are in Department RUH 5000 in our training environment. Main toolbar icons. At the top of the screen, you will see the main toolbar icons. You may also notice that some of the icons are grayed out until you select a patient from either the patient list or the status board. You can customize your toolbar by going to Preferences and clicking on Toolbar. From the Customize Toolbar window, you can add icons from the Available Buttons window by clicking on the icon you want to add and then clicking the plus button, which moves it to your selected layout view. Icons can be rearranged using the up and down arrows, and labels can be added to the icons by changing your main toolbar preferences and tab toolbar preferences from text options, no text labels, to show text labels. When finished making changes, click OK. Now you'll see that your main icons have labels underneath them. Going through some of these icons, we have our previous patient and our next patient. This allows you to navigate through patients. The refresh screen icon gives the option to manually refresh the screen if waiting for, say, an urgent result. To find a patient, click on the Find Patient icon. Enter as much information as possible into these fields to ensure you are only looking at the individual patients you need to find. Once you have entered all the information, click Search. The bottom section will populate with all patients that fit your entered criteria. Select the appropriate patient only and click Show Visits. You will then get a listing of all visits for this patient. Ensure you are looking at the Admit Date column so that the most recent visit is selected. Either double-click on the visit you would like to view, or click on the visit and click OK. The Override Chart Access screen will appear asking you to input a valid reason for why you are looking up a patient not assigned to your unit. Enter in a reason from the drop-down menu, And if there's any other pertinent information that needs to be added, this is a free text box where you can add that information here. Audits are done routinely on override reasons provided. If the reason does not appear to be valid, you will be contacted and questioned by the Privacy Department. When all information is added, click OK, and your patient is now added to a temporary list. To see that patient, you'll have to move over to your patient list, and then you can see your patient here.
Click on the status board button to return to the status board view. Now continuing with our main toolbar icons.
Print reports may be used by unit clerks to print off census reports and physicians' lists. The Enter Document icon allows access to the structured notes for those clinicians documenting electronically. Health issues are medical and surgical information entered by EDRNs. The PIP icon brings you to the Pharmaceutical Information Program website that requires special access to view. SCM Viewer directs the end user to a secure website developed for Saskatchewan healthcare providers, enabling access to patients' information regardless of where a patient seeks care or lives in the province. The EHR Viewer provides access to clinical documentation, including emergency department and inpatient physician documentation, laboratory test results, and medical imaging reports, medication information summarized from community pharmacy data, chronic disease management information, immunization records, clinical interactions such as acute care admissions, discharges, and transfer summaries, and standardized operating reports. If you do not have access, click on the SCM Viewer icon and then follow the link to register a new account. Enter in your credentials and click Submit. They will contact you with login information at a later time. Forms on Demand allows the printing of clinical forms for manual documentation. All forms will print with a patient's digital ID and barcode to support the automated indexing and appropriate placement of scanned documents into SCM. ELOS search, or estimated length of stay, directs the end users to a website for gathering the estimated length of stay based on admitting diagnosis, which is updated in the targeted date of discharge column on the status board. To disconnect from SCM, click the Disconnect icon. The Disconnect icon will take you back to the Citrix storefront screen. Patient Header. Think of the patient header as the spine of your chart binder. All the pertinent information of your patient is here. The patient's name, age, birth date, and gender is all generated from the patient's health card information. The patient's location is listed under the patient's name with the facility, the unit, and the room number that they are in. You can see the patient's admission date, as well as whether or not they are a confidential person. The provider for the patient is seen at the top of the screen, as well as the patient ID numbers, which is their MRN and visit number. If the patient has any isolation statuses, such as MRSA, MDRO, VRE, or CPO, the information will be listed here, as well as if they have any health issues, such as LTP standing for lung transplant or bleeding disorder. If we are pretending that the patient header is like the spine of our chart, then these headers are the tabs within our chart. The status board. The status board is a snapshot of who is in the clinical unit and any critical information necessary to know at a glance. This screen refreshes automatically every 30 seconds, or you can do a manual refresh if needed sooner. At the top of our status board, we have Department, which defaults to the clinical unit that you are working on. The View is a drop-down list that can be sorted to the particular area you are working in. Example, all beds view or all patients, or OBS would be your observation unit, etc. Underneath, we have our unit dashboard, which provides a numerical overview of the clinical unit's columns. There are standard columns that are on every inpatient status board, such as location, patient, age, and our MD column. Location is the physical location that the patient is in. Beside that, we have our status column or STS column. This can refer to either the status of a bed or the status of a patient. To change a bed status, you can double-click on the status column to view the drop-down list of available options. When a patient is removed from the status board, the bed status automatically updates to dirty. To change a patient status, double-click on the patient's STS column to view the available options. These options are connected to the unit's dashboard, which will be used during daily flow rounds to report unit capacity. On the dashboard, active patients is the amount of patients that can be admitted to the unit. Ready is the number of beds available on the unit. Dirty is the number of beds that need to be cleaned on the unit. IP stands for inpatient and is the number of admitted patients on the unit. DIS stands for the number of patients confirmed for discharge today. DB stands for the number of predicted discharges today but have possible barriers. D-1 is the number of patients to be discharged in 1 day. D-2 is the number of patients to be discharged in 2 days. D-3 is the number of patients to be discharged in 3 days. And D+ is the number of patients that are waiting for a test or consult so that they can be discharged or transferred. ALC stands for alternate level of care, and the patient is unable to return to their previous home location. T-1 is the number of patients to be transferred in 1 day. TD stands for the number of patients to be transferred to another unit or hospital today. T+1 means it has been 1 day since the transfer order has been written. T+2 means it's been 2 days since the transfer order has been written. And T+3 means that it's been 3 days since the transfer order has been written. T greater than 3 means that it's been greater than 3 days since the transfer order has been written. The diagnosis column is a free text column to accurately reflect the patient's diagnosis. You may also notice as we scroll through the status board that there are various pandemic and vaccination columns. These are a mixture of drop-down lists and free text fields. When scrolling through your status board, you'll notice that the patient's name disappears as we scroll. To lock the patient's name column in place, you can right-click on the patient's column and choose Lock Column. This way, as we scroll through, we can see which line pertains to which patient. The Isolation Alert column is a drop-down option that matches the color coding system for the SHA isolation alerts. When an isolation alert is selected, the isolation precaution icon will display in the patient's name column. Scope of treatment corresponds to the resuscitation status and medical treatment decided for the patient's care as per the Saskatchewan Medical Order for Scope of Treatment. The bed assigned column will auto-populate with the bed number and the readiness of the bed when assigned to the patient. When you see a bed number that is gray, it means that the transfer bed is currently occupied by another patient. Brown, the transfer bed is dirty and needs to be cleaned by housekeeping. Yellow, the transfer bed is in the process of being cleaned. And flashing green, the transfer bed is clean and the transfer can take place. ALC stands for alternate level of care. When the alternate level of care document is electronically completed and saved in Sunrise Clinical Manager, the date and time that the document was saved will auto-populate into the cell. When updates are made to the document, it will update the date and time in the cell, or if the patient has been reverted back to an acute care status, it will indicate reverted. TDD, TDT stands for Targeted Date of Discharge and Targeted Date of Transfer. This column is a calendar drop-down and is to be filled out within 24 hours of admission. To enter today's date, you can double-click on the square, or you can click the calendar drop-down to choose a further date. The Transfer Out To column appears only on critical care units or units with observation beds to signify when a patient has stabilized and can be moved to another area. The Discharge Path column is a drop-down list with 12 options to choose from on where a patient will reside post-discharge. Alternate tier transfer is a checkbox to be selected if a patient is being considered or confirmed for transfer out to a lower tier location. Example, from a Saskatoon Tier 6 hospital to a North Battleford Tier 5 hospital. Primary discharge barrier is a drop-down list of possible barriers a patient is experiencing that is resulting in their inability to be discharged. Discharge planning is a free text field to add any other information needed for discharge. The Transitional Care Status column is connected to the Patient Care Needs Assessment document. When electronically completed and saved in Sunrise Clinical Manager, the status will auto-populate in the cell. The Nurse column is a free text field to be filled out once a shift to indicate the provider caring for the patient. Consult service is either a free text box or a drop-down list to indicate which specialty physician consultations have been contacted to see the patient. The New Result column will auto-populate as results become available from laboratory services, medical imaging, and non-invasive cardiology. Double-click on the flag to view the results. The New Results column will auto-populate with a flag as results become available from laboratory services, medical imaging, and non-invasive cardiology. Double-click on the flag to view the results. We ask that you use the red X or Don't Clear flag to exit out of the results. Only medical staff should clear flag. Temporary location is a drop-down list of locations to indicate where a patient is for a short period of time, example, a test or a procedure. The Comments column is a free text column to communicate information to other healthcare professionals. And the Name Alert column is a checkbox to be used when denoting that patients have similar last names in the department. When checked off, a symbol is placed in the patient's name column. Some of the symbols you may see in the patient's name column is the isolation precaution symbol, the symbol indicating that patients have similar last names in the unit. The sunglass symbol indicates that a patient has asked to be flagged as a confidential person in Sunrise Clinical Manager. The patient's name will display as a white cell, but you can select the patient and their personal information will be displayed in the patient header. The yellow triangle and exclamation mark symbol indicates that a patient is greater than 70 years old. This symbol indicates that the patient has a bleeding disorder. And if you see any of these symbols, it indicates the status of the flu vaccine ordered or administration. Patient tabs. After the status board, the first tab available to us is the Orders tab. Please note, an Options panel is available to be used on Orders, Results, Documents, and the Flowsheets tab. The default date range is set to viewing the last month, with the exception of viewing Orders and Flowsheets, which is defaulted from the start of the chart. To view information older than 1 month, click the drop-down list for the quick pick. You have the option to select up to 3 years ago or use a custom date range. Filters can also be applied to show specifically what you are needing to know on your patient. The Orders tab shows orders that have been entered and processed. They are displayed according to the department and are dated in a descending order according to order date. The Orders tab also shows the status of the order,
when the order was completed or canceled,
and when the order was entered into the database. This tab allows for searching of specific orders. You can do this by locating the search field above the order summary line. Type in the field the specific order you are trying to find. Search by clicking either the magnifying glass or the Enter key on your keyboard. You can now see all the electrolyte orders that have been entered on this patient. To clear your search, click the black back arrow. You have the option to do an advanced search as well in the Orders tab. To do an advanced search, click on the blue down arrow in the search field bar to expand the order search filters. Click on the desired search filter to narrow the search criteria and type in the order you are trying to find. To search, click on the magnifying glass or click Enter on your keyboard. You can now see all the electrolyte orders that have the status priority pending collection. To clear your search, click the black back arrow. The Results tab. The Results tab, just like the Orders tab, has an options panel that you can filter your results as you need. The default setting will show all available charts, meaning you will see all results for the patient for all hospital visits, not just this visit. If you only want to see the current visit, change the selection to this chart. The default setting for date range is 1 month ago, meaning you will see all results for the past month. You can change your preferences by changing the date or selecting an option from the drop-down menu. There are 4 different ways to view results. The first view is called the Summary View. It is organized in a grid format by date and category. There will be a flag in the grid if a result is available. The 3 types of flags you may see are a green flag, meaning all numerical values are within normal range, a red flag, which means a numerical value is outside of the normal range, and a yellow flag, which means the result contains text, therefore SCM cannot determine if the result is abnormal or not. When you double-click on the flag, it will open the result in the Report by Order view. The Report by Order view shows all available results organized by date. Text results will either have a media link icon or a plus button to click on to open a window with the content. You can read through the result and then close the window. The Trend view only works for numerical results. It will show you the results in a grid style view to easily track changes in values. In the Trend and Graph view, you can select one item from the Trend view and have it placed in a graph. When in the Report by Order, Trend, or Trend and Graph view, you can search for results the same way we did on the Orders tab.
Here you can see all the sodium results on this patient. Click the back arrow to refresh your search. With this advanced search, you see only the abnormal sodium levels on this patient. To clear your search, click the back arrow.
The Patient Info tab. This tab shows personal information regarding the patient that has been entered into Sunrise Enterprise registration. Not all information is entered into SCM at this time. You may find information in the Care Provider section, Health Issues, including infection control, medical and surgical history, Significant Events, including any limiting factors on the patient, Addresses, phones, and contacts, Demographics and visit data, Financial and employer information, and Visit history. The Documents tab. There are 4 types of documents under the Documents tab: Structured Notes, Dictated and Transcribed, Scanned Notes, and IntelliSpace Perinatal. Structured notes are clinical documents that are entered directly into SCM. To open these documents, you can double-click on the name. To close the document, click the red X at the top of the document screen. Dictated and transcribed notes are clinical documents that have been sent electronically from the provincial dictation system to SCM. They are opened the same way as structured notes. Scanned documents have a media link icon at the beginning of the row. These are documents that have been scanned in from the Health Records Department at Royal University Hospital, which started in June of 2017. To view these documents, you must click on the media link icon. Otherwise, you will get a screen saying that this document has an associated image. The media link opens the website Perceptive, which then allows you to view the document. When finished viewing the document, you can exit out of the program. The last document type is IntelliSpace Perinatal or ISP documents. In September of 2018, all obstetrical documents of client's care after 16 weeks gestation became available after discharge. Just like the scanned documents, these documents need to be opened through the media link. You can read through the document and then close when done. Flowsheets tab.
The Flowsheets tab is where you will find electronically completed flowsheets on a patient.
You can choose which flowsheet you would like to view under the Options panel. To expand or collapse all of the rows, you can use the icon Expand Collapse Rows. This allows you to read the information under the pertinent time columns. The Visit Record Review tab. The Visit Record Review tab enables you to navigate to specific sections of the visit record and filters the information that is displayed. The Visit Record Review tab can be used for handover reports and is a good place to print off patient documentation for patient transfers. Please note, as indicated by the disclaimer on the Visit Record Review tab, the information contained in the visit record has been extracted from the patient's record to provide a clinical overview. It is not intended to be used as a complete medical record. Other paper documentation will exist that is part of the patient's complete medical record. The navigation tree on the left-hand side of the screen allows you to choose specific sections of the chart you would like to view. If needing to print pieces of the patient's record, you can do so by going to the menu button on the right-hand side of your screen and then clicking Print. Before printing, select the appropriate printer and then either select all or select individual sections of the chart you would like to print. To see a preview of what you'll be printing, you can click under the Print Preview Show Preview button. When you are happy with your print options, click Print. The Clinical Summary tab. The Clinical Summary tab pulls information from the current visit into an at-a-glance view. The summary shows most recent lab results, vital signs, medical imaging, health issues, significant events, triage information, ED clinical documents, care providers, and visit history. This tab can also be used for handover report if desired. The last tab is the EHR Viewer. The EHR Viewer tab allows care providers who have an EHR Viewer account to launch the viewer directly from SCM and makes the correctly selected patient's EHR Viewer information available directly from the SCM tab. When you are done using SCM, ensure that you correctly log off your session. To do this, click the red Shut Down All Scripts Gateway button on the top right of your screen. If you have any questions or concerns related to SCM, please contact the eHealth Saskatchewan Service Desk at 1-888-316-7446 or email servicedesk@ehealthsask.ca. Thank you for watching this informational video on the SCM Viewer.